Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Waqar from Child Health Matters. Today I will talk about how to take a consent from a parent or a caregiver of a child for the lumbar puncture. So as you know, in MRCPCH clinical exam, the communication station, you might have the scenario that a child who needs a lumbar puncture, you should have to take the consent from a parent or a mother or a caregiver of the child. So how to take a consent for the lumbar puncture? What questions the mother can ask, and what are their concerns? And definitely you have to tell about the indications, you have to tell about the drawbacks, how will you manage the drawbacks, and why you need a lumbar puncture, and after that what you will do. So here you have to take the consent. Just keep in mind you need a consent from the mother. So I have seen many candidates who are telling them each and everything about the procedure, about indications, drawbacks, management of drawbacks, everything they are telling to the mother for the lumbar puncture, but they forget to ask that I am here to ask you a consent. I am here to take a consent from you for the lumbar puncture. So it is very important. You must say that you need a consent. Before I going to start, please subscribe my channel for further informative videos. So as you know, in communication, first of all, you have to introduce yourself, you should make the repo, you should clear your role, and you should ask for the attendant, and previous knowledge of the mother means what mother knows. So these are the IRCAP you should have to follow in every communication station. Sometimes maybe in between they will interrupt you, the role player might interrupt you, so it's okay, but after they give her an answer, you can tell them again, ask about the previous knowledge and ask for the attendant. That's okay. This is a part of communication. So initially, if you are going to ask for the consent, it is better, there is no hard and fast rule, either you should tell about the consent in starting or at the end of scenario. But mostly it is better that if you will ask for the consent initially, so you are on the safe side, and even though at the end you will you don't have a time to ask for the consent or you forget, so it is you already asked for the consent. So it's better that you can tell the mother, I am here to take your consent for the lumbar puncture. Then you should start about the procedure, why we need, definitely mother wants, why are you doing the lumbar puncture, what is the reason. So you should tell the mother that we are suspecting that your child might have bug in his brain, and that's why we need some fluid, we need little fluid from his brain and the bundle of nerves which are on the back, which we call the spinal cord. So this fluid will tell us which kind of bug your child has, so that we will start the antibiotic anti-bug medication accordingly. Okay, so why don't you start the anti-bug med? Already we have started anti-bug medication, but it is necessary that we should know what kind of bug, so that we will give him the appropriate anti-bug medication. We cannot give him every many antibiotics, many anti-bug medications. We cannot give him for more than 2 weeks or 21 days all anti-bug medication if we know what kind of bug he has. So it would be easy for us to give him the medication, and we know how much time we should give. Okay, then you should talk about the procedure. Definitely mother has concern, is it a painful or not, and my child might have the headache, my child might have the paralysis. So here you should talk about the procedure. It is the small procedure And as you know, every procedure has some drawbacks, like it might cause the pain, but don't worry, we will apply some gel at the site where we prick the needle. At the low back, you should have to draw. If you draw the back and you show the mother that where you insert the needle, it would be helpful to understand for the mother. And you will tell that we will insert the tiny needle, but before that we will apply some gel. We will make the area numb so that your child will not feel pain, but he might feel some pressure. So this is for the pen. And there are other drawbacks, like for example they might have the bleeding, where we will make sure that we will apply some pressure after the procedure to stop the blood. And they might get the bug at the site of injection, and we make sure that we will do this procedure in clean environment. In all sterile environment, we use all sterile gloves, and we will make sure that it is in the clean environment so that he will not get the bug from our procedure. Okay, so these are the drawbacks. Okay, but he might develop headache. Yes, mom, he might have some headache, but we will make sure that we will give him some painkillers after the procedure. And well, the other concerns they have, I have heard mother can say that I have heard that the child who have a lumbar puncture, there is a chance of paralysis, there is a chance of weakness of the lower limb, and it is for the long life. So yes, at that time you should say, mom, as you know, these nerves from our back goes to these nerves of our from our brain and from the backbone. It supplies to our lower limbs and legs and also arms. So where we insert the needle, which is the lowest area where there are no nerve endings, usually that area is safest area from where we are collecting the fluid, and we will make sure that it will not cause any injury to the nerves. Okay, so how would you talk about prevention of the drawbacks? As I told you, you should have to talk about the prevention whenever you are telling them drawbacks. For example, drawbacks of the bleeding, drawback of the getting infection from your procedure, drawback of the pain. So for the pain, you will apply the numbness cream. For the bleeding, you will apply the pressure. And for the infection, in clean environment. Okay, then the headache, it is the one of the drawback also. The headache, you will give the painkiller after that. So this is the 15 to 20-minute procedure. Sometimes this might ask how much time. It is 15 to 20 minutes procedure. It might take longer, and after that we will monitor him at least for 2 hours. And 2 hours monitoring, you will make sure that he should be in his sleep on his back, so that will apply the pressure, and will apply the dressing at the site of needle, and we'll give him some painkillers if he has a headache or discomfort. So this way, you should have to tell the mother about the lumbar puncture procedure, their drawbacks, indications, drawbacks, and management of the drawbacks. And then at the end, you should have, don't forget about the summarization, leaflets, and trusted websites. So this is the way that you should ask about the consent. And if you didn't say consent before, you can ask at the end, so are you agree to give us a consent for this procedure, so that we will go. Or sometimes mother will say that I need to discuss with my partner, I need some time to discuss. At that time you should say sooner is the better, so that we will know that what kind of bug he has, so that we will start the appropriate treatment for him. It is for his benefit. So do not give them 2 3 days, so tell them the sooner is the better. So if you have decided, just let us know, and we will do the procedure. So this is the way that you will need a consent for the lumbar puncture. And other also scenarios you might find in the MRCPCH clinical exam of the consent, like the bone marrow aspiration. So I will talk about the bone marrow aspiration as well. So for the MRCPCH clinical course, if you are interested to do, just email me your name and your contact details, so that I will send you the all details of my MRCPCH clinical course. Thank you very much.